What happens if you vape during pregnancy? Vaping fluids with or without nicotine can harm a developing pregnancy, and this includes the use of e-cigarette, which are marketed as alternative to traditional tobacco products, and vaping, CBD, THC, or other cannabis extracts. Vaping during pregnancy is not safe at all, not even for him. It is not safe. Although there is a perception that vaping is less harmful than smoking. You understand that smoking traditional cigarette or cannabis, THC products, cannabis extract, and all that. The evidence suggests that it can still pose significant risk. And I want you to know that infrequent or one-time vaping might not have as severe effect as regular usage, but it's still the best to avoid vaping altogether during pregnancy. Then how does using e-cigarette affect a developing pregnancy? When you vape nicotine or smoke cigarette while pregnant, the nicotine can cross the placenta barrier and thus what affect fetal development. Recent research shows that using e-cigarette while pregnant can do what? It can lead to a whole lot of complications. It can lead to increased systemic inflammation. It can lead to preterm birth, that's premature babies, limited or slow fetal growth. In addition to nicotine or e-cigarette often contains flavor and preservatives. Of course, what can they do? They can increase your risk of complication or other adverse effect. In 2023, there was a study which looked at vaping during pregnancy in the United States, and it found out that the mint and the menthol flavor e-cigarette fluid were associated with a higher risk of pregnancy loss, that is miscarriage, or of course stillbirth or preterm. So it is also important as a pregnant woman to be wary of diacetyl, the chemical that gives vape fluid a buttery or creamy flavor like that. And this diacetyl is associated with bronchiolitis obliterans, commonly known as popcorn lung. And it is not good for a pregnant woman. It will affect the lungs of that baby. E-cigarettes may contain other chemicals, including propylene glycol and vegetable glycerin that produce toxic byproduct when vaporized. So the bottom line, both nicotine containing and nicotine-free vaping pose significant risk to a developing pregnancy. So limiting or abstaining, total abstinence altogether can do help reduce the risk of adverse effect on the unborn baby. If you are pregnant and you want to quit vaping, what do you want to do? Consider making an appointment with a healthcare professional to discuss the various options for cessation. Counseling, support groups may also help you to quit. Remember, that baby is very, very important. You have to quit vaping. See you in the next video.